Hey there, do you have a knee cartilage problem? Do you think that your knee cartilage is causing you knee pain? Well, in this video today, I'm going to talk to you all about why knee cartilage problems happen and what options are out there for knee cartilage repair. And specifically, I want to answer the question is, can knee cartilage even heal? We've gotten this question on our YouTube channel and we've gotten it numerous times here in the clinic. And I want to answer that question for you on this video today. Now, real quick, my name is Dr. David Midoff, and I'm a specialist manual physical therapist over at Paso Manual Physical Therapy. I've been helping out people with knee problems for years, especially knee cartilage problems. Now, I've been helping out people in the clinic, but as well as online through YouTube and through our online program. We have a program called the 28-Day Knee Health and Wellness Boost Program that is specifically designed to carry somebody through the entire process of fixing a knee problem like a knee cartilage problem. So before I go into how knee cartilage can heal, let's just discuss what it's for. We need to understand that so that you can understand how knee cartilage problems can heal. Cartilage at the basics is found on the ends of bones. So wherever, like in your hand, you've got them, wherever one bone ends, another bone starts, at the junction, at the joint between those two bones, the bones are lined with cartilage. Of course, this is going on in every joint of the body. So in your knee, you've got a bunch of cartilage on the end of the thigh bone and on the end of the shin bone. And then you have your kneecap on the front. On the back of that kneecap is a thick layer of cartilage as well. The purpose of cartilage is to cushion the bones against each other, as well as allow free-flowing motion between the ends of the bone so that there isn't much friction, there isn't too much rubbing. It should just glide on itself without much noise or without difficulty moving. It should move freely, just like when you move around your joints that are moving well, you don't really think about how they move because the cartilage is generally healthy there. Now, there's different types of cartilage. The cartilage that you see on the ends of bones, again, is to cushion those bones, but there's special types of cartilage, and especially in the knee, there's a meniscus. You have two pairs of meniscus in each knee, so you have four total in your body. And they're big chunks of cartilage that are designed to cushion the entire weight of your body, not just the thigh bone on top of the shin bone, but also they kind of slip and move a bit so that they can allow for that support to happen as the knee joint moves, like during walking or running or other activities like standing up, getting down, or as you weight lift or do any sort of activities at home. That knee cartilage, the meniscus, can shift around to accommodate the thigh bone moving on top of the shin bone. Meniscus problems are frequent when it comes to knee cartilage injuries. And the good news is it can heal. I'll tell you all about that here in a second, but I just want to make sure that you have a clear understanding about why knee cartilage is there. What is the purpose of cartilage in knee joints? And just one more piece I want to tell you about this. If you ever open up like chicken bones or any sort of animal bones, if you're cooking and you look at the joint, if you pull apart two bones, you'll find that white glossy surface on the end of the bone. That's cartilage. It should be smooth. And if you find that it's ever rough, because occasionally you will find rough cartilage on animals if you open them up, that's kind of how we look on the inside. And that roughness, as a cartilage begins to wear down or age in some cases, it can make noise, it can cause problems, and it can become painful and irritated. And that's why people run into knee cartilage problems. Whenever they run into knee pain, it's because of that knee cartilage is irritated or worn down. Now let's just talk a little bit about the anatomy of cartilage. It's white tissue. Again, if you look at the inside of an animal, you'll see that the cartilage is white and glossy. And if you just peek behind me here, you can see the muscular system on this chart. And you can see a lot of red all over the body, on the front and on the back. But there's parts that are white, like right around the knees especially, there's a lot of whites. Here on the front, this is just a thin layer of fascia. Wherever there's white, there's more cartilage, ligaments, and tendons. Those tissues are known to be white tissues. The reason why they're white is because they don't have a good blood supply. It's important for healing that there's a big blood supply because blood brings in nutrients, oxygen, and it also takes out waste products, bad stuff from whenever there's damage and healing and repairs happening. So a tissue like muscle and skin that's we call it vascularized in the healthcare field. That means it has a very good blood supply. That tends to heal pretty quick. Like if you ever have a muscle sprain or strain, it heals pretty quick. Skin heals within days, at the longest within weeks, depending on how severe it is. But when we're talking about a cartilage problem, it does not have a good blood supply. So blood can't bring in oxygen and nutrients, all the nourishment that it needs very fast. And it can't take out all the waste products very fast. Also, the tissue itself is not, there's a lot of space between the cells within the cartilage that isn't alive, if you will. It's not like a cell. It's a lot of what we call collagen fibers. It's fibrous. It's molecules that are designed to cushion and support, not like skin cells and muscle cells where it's the whole thing is moving. The whole, like in muscle specifically, the muscle can contract and let go, so the whole tissue is being more effectively used. Now, that might have just gotten way too sciencey for you, and if you didn't follow that, I'm going to stop that. Just hang with me here. The point that you need to know is that it doesn't heal as fast, but it does heal as long as you put it in the right environment. And what you got going for you inside your knee is there's fluid inside the knee. In the healthcare field, we call it synovial fluid. It's joint fluid inside the knee that helps to cushion the knee, for one thing, but it also helps to nourish the inside of the knee, which the cartilage is right there. The meniscus is right there as well. So the more circulation you have through your synovial fluid, the fluid inside the knee joint, the better nourishment those parts of the cartilage that don't have a good blood supply can get. So it's critically important to do some sort of special movement for knee cartilage problems to make sure that it gets all the nourishment it needs, that it's not getting from the blood supply because it's got a poor blood supply. Now, let me tell you about some of the options that people go through to help knee cartilage problems. Of course, there's surgery. If we're talking about doing a knee replacement, for instance, what's happening in a knee replacement is they're cutting off the end of the thigh bone and they're cutting off the end of the shin bone, and they're replacing the ends of the bones with metal parts that are going to replace the bone and the cartilage and everything that was there. And they also replace the kneecap most of the time too. So you don't have your cartilage anymore, so it's not a factor. Now, it is massive surgery. It is such a major surgery. The good news is if you have to have it done, it's actually pretty well done these days. There are side effects to it, of course, and there are cases where things go wrong, and it's kind of hard to undo a knee replacement surgery. You can't. So you got to weigh the pros and cons if you're in that kind of situation. Now, likely if you're watching this video, you want to stay away from having a knee surgery, or especially knee replacement, but any other knee surgery as well. Other options that we find people are looking into a lot is regenerative medicine, which is big words for stem cell injections, PRP injections, which stands for platelet-rich plasma. It's more natural, but not quite natural, because stem cells aren't really something that we are supposed to be getting into our bodies, but there's some cool research and science behind it. And just to go there for a minute, the science behind stem cells is very mixed right now. So if you don't know anything about stem cells, maybe you've heard of it, but you don't know exactly how it works, I'll just give it to you in a nutshell real quick. There's cells that are their basic form. Because when in our bodies right now, you have eyeball cells and brain cells and skin cells and hair cells, all the different kinds of cells that make up your body started out one day as a stem cell. And with stem cell injections, the hope is that when they put stem cells into your cartilage that's injured, is that it will form brand new cartilage cells from those stem cells, and you can regenerate your cartilage inside your knee. The problem is that we haven't quite narrowed down a consistent way to get the cells to change into the right kinds of cells. So it's kind of been mildly effective, if at all. We do have some patients that come in and say that it made a world of a difference for them. And then we have some other patients that say, I paid thousands and thousands of dollars for these injections and it did nothing for me. So it's a mixed bag from what we can tell here in the clinic. What I want you to know about regenerative medicine is that it's cool, it's cutting edge. I think it's going to get better over the years, of course, but where we stand right now, it's not addressing the root problem of what got you that cartilage problem in the first place. What tends to cause knee cartilage problems is bad forces going through the knee joint over years, maybe even decades. Cartilage is designed to take pressures. If you think about your knee, you stand on your knees for most of your life and you put your body weight through them. You might jump and run and carry things with your body, and all that weight has to go through your knees. Forces have to be absorbed through that cartilage on the ends of your bones and the meniscus inside the knee joint as well. If it's not being loaded correctly because you have muscle imbalances, you move incorrectly, there's different things that happen that lead up to knee injuries for the cartilage. That cartilage begins to wear down and become affected. And if you go spend thousands and thousands of dollars to have a stem cell injection that actually works and your cartilage cells are renewed, but you haven't changed the forces that are going through your knees, you're still moving bad, your muscle imbalances are still there. It's just a matter of time before those brand new cartilage cells become injured and you're back in the same situation. And even with a knee replacement surgery, same thing happens. We see it here in the clinic all the time. You've replaced the knee, but if the movement hasn't changed, the strength hasn't really changed, a lot of times people get weaker after knee replacement. Then they end up wearing down the components that they put in for the knee replacement. The hardware, the brand new knee in there can actually loosen. There can be problems set up with that knee replacement. So it's important to fix the root problem, which is something that we as specialist physical therapists do all the time. And it's pretty cool because if we can catch a patient before they end up going to have some major procedure done like a surgery, they can actually reverse the pain that they're feeling in there, set up their cartilage to heal and put themselves in a position where they didn't have to have surgery. They're not relying on injections and medications, and they're back to being healthy, active, and mobile again. Now let's talk about the healing part of cartilage. Cartilage can heal. This is commonly debated in the healthcare field. I think it's kind of a hot topic and it's a controversial one for a lot of people because there's healthcare professionals out there that believe that it doesn't heal. And here's my stance on it, especially like surgeons that I've talked to that say, no, it doesn't heal, just go replace that knee, that's your best shot. If you put your knee in a position where you take the pressures off the knee joint, which most people don't do, it can heal. And if you can put scar tissue down in the injured part of the cartilage, that scar tissue is about 70 to 80% as strong as your original tissue. And that's not too bad. If you can fix the root problems of the knee, all the muscle imbalances, all the other issues, 70 to 80% strength scar tissue within your cartilage in your knee is good. You can walk on that. You might even be able to jog on that. Going up and down stairs shouldn't be a big deal with 70 to 80% as strong tissue as before. That's better than a stem cell injection that did nothing. And that can naturally happen in just about everybody as long as they're overall healthy. As specialist physical therapists, we take people through the process of healing a knee cartilage problem so that scar tissue can be laid down effectively. Now, one question I get often from clients is, well, what if I have too much scar tissue and it's not letting me move? That is a minor concern. Scar tissue rarely is too much. It's only too much in two situations. There's something called keloid scars. You can Google it. And that's when people scar way too much. And you know when you've got keloid scars. If you look around any scars you've got on your body, they're raised. They're usually a big bump. They kind of are gnarly looking. People are usually embarrassed to show you their keloid scars. If you have keloid scarring, then I'm concerned. You might actually put down too much scar tissue, but that's rare and you know it when you've got it. You've been like that since you've been little. The other problem that people get excessive scar tissue where it's concerning is if you've had a surgery, if you've gotten to have a knee replacement where they have to slice your whole knee open on the front to expose all the ends of the bones and all the muscles, that's massive surgery and those incisions all have to close up. You might lay down too much scar tissue in that case too. But if you haven't had surgery yet, you've just had some cartilage damage, then it's not too big of a deal. You should lay down scar tissue normally, and that scar tissue is going to be 70 to 80% as strong as the original. That's a great situation to be in. So guys, I hope this video was helpful for you in learning about how knee cartilage can heal, how it works, what other options are out there. If you found this video was helpful for you, please hit the like button right here. And I'm gonna release another video about how to tell if you've got a knee cartilage problem. I'm gonna give you some tests that you can do right now at home. Stay tuned for that video. If you wanna catch that video, make sure you hit the subscribe button right over here. and hit the notification bell to get notified whenever we release this video. And in case you're catching this video later, we've already released it, you can probably check it out in the description here below. You should be able to find the link in there. I hope you have a wonderful day. We'll see you next time, guys. Bye-bye.